Hey, Dr. Troy here, Vancouver Chiropractor. I want to talk about the integrity of the motion segments of the spine. Wow, big word, but listen, there's 313 spinal joints from the base of your skull all the way down to your sacrum and your low back. There's 313 spinal joints that go through a certain range of motion. And so we know what normal range of motion is. We know what abnormal range of motion. What we want to talk about today is that integrity of motion. So if the motion in a motor unit, say this here, the second and third or fourth and fifth cervical vertebra, if that motion of that joint isn't proper, it's aberrant, it's abnormal, it's restricted, what's going to happen? There's a whole complex of things that's going to happen. And one of the things that people always go, well, what causes it? They go, I wasn't in a car accident, but that's only one cause of aberrant joint motion. It could be sleeping wrong. It could be sitting on a plane too long. It could be sitting in a car. It could be your computer work, your desk work. It could be a trauma. It could be a slip. It could be a fall. It could be a fall when you were a kid off your bike. And the underlying cause has been brewing for many years. So if we've got loss of motion segment integrity, that's going to have, number one, it's going to have a muscular component. So therefore, the muscles may be tight or restricted on one side versus the other. You might have adhesions, fibrosis, which is kind of like that little piece of gristle in the New York steak. That's fibrosis. So you start developing that in the soft tissues. You could have ligament issues, you could have disc issues, and always when there's a vertebral subluxation, there is a neurological component. That means the messages coming out of the brain through the nerves are going to be disturbed. They're going to be congested. Well, what does that look like symptom-wise? And it varies. It can, because everybody's wired very similar, but yet they're different. So you could have skin issues. You could have sensitivity in your skin. You could have loss of reflexes. You could have numbness. You could have tingling. You could have burning, sharp, stabbing pain. You could just have tightness. These are all signs that there's aberrant spinal joint motion. And over time, if those joints don't move and there's been trauma or there's just been trauma and no movement, those joints will degenerate. And so how do you know that it's there? Well, you have to get checked. You get examined. X-ray helps us see, is there decay in the spine? How long has it been there? Because decay in the spine is a predisposing factor for a lesser quality of life. Doesn't mean everybody is going to have that if they've got decay in their spine, but it's a predisposing factor. So I always recommend people get checked to see what's going on with them. What are their symptoms? Let's correlate that to see if there's aberrant motion in the spine. And if there is, we can help. So if you're interested, come in. We'll check you. The consultation is always free in our office. The phone number to call is 360-260-6903. This is Dr. Troy serving Vancouver for over 22 years.